haven't seen any medication that actually has such a huge reach as well as consistency and effectiveness with these GLP-1 agonists like Tirzepatide and like Botox. Despite the fact that they're medications, I mean, who wants actually quote like medications necessarily to jumpstart your life, right? Or change who you are. But I think the stigma of the days in which we say, oh yeah, like medication is bad for you. I mean, we know that 40% of adults are actually on antidepressants. A lot of times you need that positive reinforcement to actually be motivated to actually make those changes.
Hi everyone, my name is Pauline. I'm from Wave Plastic Surgery. Today we're going to be talking about Tirzepatide, and we're going to be joined today by none other than Dr. Peter Lee.
Hello.
I'm nervous, Dr. Lee.
You don't have to be.
No?
No.
Okay.
Just us talking.
Have you done podcast style stuff before? Me neither. Well, there's always a first.
So how did you get recruited for this?
I have no idea. I was volunteered. Alan called me. I was in Roland Heights, and he was like, "Hey, Pauline, are you busy?" I'm like, "No, we're doing a podcast." I'm like, "Me?" Okay, so first let's talk about Tirzepatide.
As a plastic surgeon, I mean, we deal with obesity all the time, right? As well as chronic disease. I think in my career, right, I haven't seen any medication that actually has such a huge reach as well as consistency and effectiveness with these GLP-1 agonists like Tirzepatide. I haven't seen anything like that since like Botox, really. Yeah. It just seems like it works consistently on everyone. Yeah, I mean, some people have some side effects, and we can talk about the side effects a little bit later. But, some people, do develop side effects, but on a consistent basis, the side effect is certainly rare and mild. But the effectiveness is just so real, yeah, and tangible.
Right. I myself took Mounjaro or Tirzepatide for about a month and a half or so. Side effects wise, it was very mild. It was more gastrointestinal related issues for me. It was a little bit of nausea, but another biggest one for me was fatigue.
Yeah.
That was the biggest one. I was so tired all the time. But yeah, overall, I lost maybe 12 to 15 pounds on it. So it's amazing. Life-changing, honestly.
Were you able to keep it off?
Yes,
Yeah.
I was. But, that's with like lifestyle changes too.
Yeah.
You can't go into it thinking like, okay, this is the magic drug. This is what's going to fix my weight problem.
Mm-hmm.
I think for me, I used it as like kind of like a jump start.
Yeah.
I used it as a jump start. And then from there, I just tried to keep the weight off, working out a little bit more consistently, eating a little bit better. Because I would assume like if you went back to your old ways, the weight is going to go back. And I think that's what a lot of the people, are wondering about is is this a lifelong medication? Do you have to be on it for a long time, or like, does the weight bounce back if you're off of it? What are your thoughts on that?
I mean, there's no question that if you stop the medication, the effect that it has obviously, goes away, right? Having said that, though, I mean, if you look at the people who has been on Tirzepatide, and in our clinics, I mean, that's what we actually focus on because Tirzepatide just seems to be much more effective and, like I said, more consistent. That works on everyone versus the semaglutide. Right. But certainly, I mean, our patient base are not really necessarily taking it for necessarily medical reasons, right? And in fact, I mean, a lot of our patients don't really even fit the criteria of morbid obesity, right? I mean, morbid obesity being what? I mean, we usually talk about like BMI of greater than 30 or like BMI of what? Greater than 28, I believe, with comorbidity, right? With other medical problems. But, I mean, a lot of our patients, probably not like you, okay? who's looking to lose like maybe 10, 15 pounds. But a lot of the patients, are not that morbidly obese. That just, wants to really kind of lose that 20 pounds or so, right? A lot of the patients, who took it for maybe like 3 to 6 months, they are able to actually kind of keep it off.
Keep it off, yeah.
Right. And I think there is something to be said about positive reinforcement. Okay. And I think that's what's missing a lot of times, right? When you do something, and let's say you don't really see the result, right? Or at least it takes so long, for you to really realize and be rewarded with that result. Mm-hmm. A lot of times, like you lose that kind of that motivation, right? Whereas with something like Tirzepatide, right? You take it. You said you only took it for like a month or a month and a half, right? And you lost 10 to 15 pounds. That's significant, right? And when you see a result like that, then I think, people, because, they see that result and they're happy with that result, that they're motivated to actually truly do change that lifestyle, right?
To keep it off.
Exactly.
Like, I don't want to pay more money to do, so the best way to do it is really lifestyle change.
Right. We've been preaching, like I said, at the start of this conversation, right? And I said, we've been preaching for a long time, right? About diet and exercise and things like that. But a lot of times you need that positive reinforcement to actually be motivated to actually make those changes, right?
That is true.
And I think, these, medication, despite the fact that they're medications, we don't want, who wants actually, quote, like medications necessarily to jumpstart your life, right? Or change who you are. But I think the stigma of the days in which we say, oh yeah, medication is no longer, medication is bad for you, right? So, we know that 40% of adults are actually on antidepressants, right? And so I think like there is an acceptance now, right? That, medication actually can help your lifestyle, right? And, if obesity is an issue, right? You've been trying to actually take that weight off, but you couldn't. Hey, like if you can take the medication for, 3 to 6 months and really kind of jumpstart that positive reinforcement, I think that's actually, I think there is something to be said about that.
And a little backstory, I did try to before actually going on the medication, obviously I did my due diligence that I'm actually working out and eating healthy, but that 10 pounds just wouldn't, shut off. And so that's why I decided to try the medication, and it worked really, really well. Right. So what are the side effects that we've seen with people taking Mounjaro?
You started talking about your experience, right? You talked about nausea and fatigue, right? And you're right. The most common effects are gastrointestinal related, okay? And it is something like nausea, vomiting, constipation, or diarrhea, okay? It's consistently, it seems like it's those 4 elements that some people may experience. Some people actually don't, okay?
Right.
Some people also talk about, and especially if they have problems with acid reflux, sometimes that becomes a little bit more manifested, it seems like. But certainly not really so severe, although there has been cases of people who have experienced kind of a severe symptoms.
And what would the severe symptoms be?
Yeah, it is things like nausea and vomiting.
Okay.
Some people have experienced significant vomiting episodes, so that they, when you vomit a lot, you can become dehydrated.
Right.
And so you have dehydration symptoms, right? That may require, some intervention like rehydration and so forth.
Is that does that have correlation with the dosage that the patient is taking? Right? I think as you increase in dosage, your symptoms become a little bit more prevalent.
Absolutely. Okay? I mean, what we noticed was, and they come in different dosages. And it does seem like it is correlated with higher doses.
So the lowest dosage is 2.5. It goes to 5, 7.5, 10, and then the highest dose is 15
Right,
milligrams. Is
right.
that correct?
Yeah. And you're right. Like, because of that, when we're prescribing Tirzepatide for weight loss, we do want to start slowly. Okay? And so, like, probably somebody like you, we would want to start like at the lowest dose, like 2.5 milligrams. Like, curious, like, what dosage did you take?
I did the first week, I did 2.5. Following week was another 2.5. And I did 5 milligrams the third week and another 5 milligrams the fourth week.
Okay.
So I stayed on the lower end of it, and I was still able to lose, a significant amount of weight.
It seems like you condensed it in a short period of time, right? Although for most people, they would actually be on the same dosage for that full 4 weeks. Right. So, like for you, kind of like a standard, dosage would be to put you on 2.5 milligrams
for a whole month.
Yes, for the whole month. And then on the second month, maybe go up to 5, right? And then if you want to just do a 3-month treatment, then kind of taper off at 2.5 the third month, right? And then stop.
So you go, first month would be 2.5, 5 milligrams the second month, and then taper it down back to 2.5, right?
Yes.
Okay. Does that like affect just the rebound weight, or is that just so your body kind of gets used to not being on the medication?
Yeah. I mean, I think it's probably both, right? But I think at the end, it is acclimation, right? And I think one of the reasons why, some people actually do develop more GI effect with higher dose is, I mean, it's an acclimation. It's a shock to the system of the body, right? Whenever like, your metabolism, changes. I mean, of course, I mean, some people like adjust easy. So much individual variances, right? I mean, you can't kind of standardize everyone, right? But if there is a sudden change to the body system, then of course, I mean, you need time to adjust. Yeah, and always gradual is better than too sudden.
That is true. Have you heard of compound Tirzepatide? I have heard about that from other patients. What are your thoughts on compound Tirzepatide?
So just so that we're clear, some people don't know what compound means, right? What compound means is there are pharmacies out there that would dosage and taper a generic version of the medication, right? And a lot of times they would do that either because there's shortage of the medication, which currently there is.
Yes, I have heard of a shortage of it.
Or sometimes, like they would actually tailor it and customize it to a certain patient, especially if you need to add certain other ingredients to customize for that patient. And on average, it does seem like there is a cost benefit to that as well. Okay.
I think it's cheaper to get compounded Tirzepatide.
Right. I guess there is a price to be paid for a brand. But okay, so we in our clinic, I mean, we don't do compound. Okay. Whenever you do compound, there is less oversight, right? So, I mean, when you say compound, not all compound is the same. And it is, the pharmacy that you use, for the compound, and the consistency and the purification of that, generic medication as well, and the reliability of it as well. I think like, especially when something is new, right? You have to be much more, I think, careful.
Yes.
Okay. about where you're getting that medication from. Okay, doesn't mean that compound Tirzepatide doesn't work or it's unsafe. And so, we certainly at this stage don't feel, and it's a personal belief within our organization that we don't feel comfortable necessarily going the compound route. But I have seen people who's been on compound Tirzepatide that has benefits. And then I've also seen some patients who've used compound Tirzepatide that didn't quite have as much benefit.
Success, right. Is this FDA approved? Do you know?
So the compound medications are certainly not FDA approved.
Right, yeah. Okay?
But because there is a shortage of the medication, that it is allowed.
I see.
It's an allowed. It's not like a FDA approved medication, but certainly the generic versions, it is allowed to be distributed, to patients.
Let's talk about Zepbound. We talked about that Mounjaro is the diabetic, and then Zepbound is for obesity.
Right.
Yeah.
Right.
What are the differences? Is there any difference?
Yeah, exactly. None. Okay. Yeah. I mean, and that's where the confusion is too, right? But the reason why the companies are coming up with different names, for these, is so that they can actually keep it separate when they collect data.
I see.
Okay. And that seems to be true
sense.
in all medications. When it first comes out, that they want to keep the data separate for. We're obviously dealing with two separate issues, right?
Right.
Weight loss versus diabetes treatment. Yeah, but they're exactly the same, and they come in exactly the same
packaging
dosage
as well, and dosage, correct?
Yeah, except the name and packaging.
Yeah, it's just Zepbound versus Mounjaro, right? For patients that are are interested in doing weight loss, how do we go about that, or how do patients start with taking Tirzepatide?
Right now, certainly Tirzepatide is prescription only, right? So it is a physician that needs to assess a patient and then start them on a certain dosage, right? But in terms of the dosage, right? And how to start off. Yeah, I mean, I think it's really important, like everything that we talk about, like when we talk about medically supervised, in programs, is that, you really have to customize people depending upon, who they are, right? What type of medical problems that they may have had, what type of history that they have. And, for something like weight loss, it really is about, what is the goal and target?
How much weight they want to lose.
Right.
Okay.
And so, you really have to factor that in, not necessarily like, with a dosage to start, but also, throughout that entire journey. And I really feel like something like weight loss is something that has to be monitored, right?
Of course, yes.
Because like anything else, and we talked about the positive results and the effectiveness of the positive results. That in order to maximize the effectiveness of it, you really do have to kind of follow up, right? It's not a one and done deal, right? And as we talked about, a lot of times it is a duration of treatment, right? There is no real protocol right now that says you have to be on it lifetime for weight loss. Yeah, I mean, it really is a program that has to be kind of custom tailored towards the patient. And so, whatever dose that you start with, you may need to change that dosage, if
you're plateauing.
Yes. Right.
And that's when physicians come in, right? Is that you assess where they're at, managing their side effects,
Right.
stuff like that.
Exactly.
Right?
And certainly within our program for weight loss, I mean, we do want to see the patients, once a month, right? To see exactly where they're at, right? And I mean, obviously, talk about the side effects that they may have experienced, how much weight loss that they have had, and how much is there really to go, right? And depending upon, how that first month have gone, we may, increase it to a certain dosage. We may want to increase it even more than kind of an average.
Right.
Okay?
So tailoring it depending on how the patient is going.
Exactly. And I think it's so important to keep a very close monitor on the patients.
Of course, yes. Because in the end, it's still kind of a medical treatment.
Of course. I mean, and these are medications, right? And no medication actually works the same for everyone. And so, yeah, I mean, I think it's so important to actually have a very tight
supervision.
Yep, oversight. Yeah.
So I know there's some patients that are really scared to do the injections by themselves. So we do offer patients actually to come in and then we do the injections for them. Although it is a very simple, very easy process, it comes in a pre-filled syringe. You don't even see the needle. Right. But yeah, there are patients that are really scared to do it themselves. So we do offer them to come in and help them out with it.
Yeah.
So.
Yeah. I mean, although it's a once a week injection, and we're obviously in the medical field, so little injection is nothing for us.
Yes.
But I think for a lot of people, it's a barrier that they actually do have to cross, and it's something that that they may feel more comfortable, us administering. And so, I think what's really important is that for everyone, it's a little bit different. But the reason why we talk about medically supervised weight loss is that for some people, what is beneficial is to have a consistent sort of nutritional supplement, right? And a lot of times it does seem like, like IV therapy on a consistent basis, on a weekly basis or a monthly basis, it does seem to benefit them, right? We have like multitude of IV therapies that's available, right? But certainly supplementation of especially the vitamin B complex, okay, seems to affect patients and give them a kind of a boost of energy, which I think also kind of again makes the compliance of the medication actually consistent.
That is actually very important.
Yeah.
All right. I think that wraps up this episode about Tirzepatide and Mounjaro. Thank you for joining us, Dr. Lee.
Thank you.
Giving insight about this medication and how it's come about and, questions what people have.
Yeah, I mean, I really don't say it lightly. But like I said, I mean, I think something like Tirzepatide is the type of medication that doesn't come very often. And I've been extremely impressed with the effectiveness of it. And, for a lot of our patients, right? I mean, weight loss is not just weight loss, right? It's kind of a means to other treatments, right? Because a lot of our patients are actually coming in for body contouring, right? But they may not be like a real perfect candidates for body contouring, for example, like liposuction, because, they have visceral fat and, they need to reach their target weight first, right? And so, when they can actually truly sort of get to their target weight and be able to experience a body contouring procedure in an ideal environment, right? I mean, the end result of the procedures that we do, is much more impressive and significant.